Okay, good evening. Today's topic is something to do with teaching techniques, like most of the parents who are parents of special needs, especially autism spectrum disorder, parents face a huge issues in just not understanding how to continue with the academic part. Because when they are going to mainstream, they know a lot of things, but they cannot generalize. So parents are little confused in the sense most of the institute don't allow parents inside their institute or let the child be observed by them or proper kind of assessment what a parent can do is not allowed, rather not taught. So what happens, children who are going to mainstream or children who cannot go to mainstream because they cannot acquire the adequate skills for academics. So what are the things parents need to understand? What are the things a parents can do something to increase the ability in academics? Before everything, you have to understand. I will not be talking about every disability. I'll be talking about neurodiversity, especially autism spectrum disorder. So when we say autism spectrum disorder, we all understand this is neurodiversity. So there are perfectly two words into it, neuro and diversity. So why we have to understand these two words? Because we know social interaction, communication, conversation is a problem with children on spectrum. So if it's a problem, we know for language development, these two skills are very important. One is mental, another is motor. So both are combined for learning language and learning academics. So the whole process of their thought is affected because neither their motor abilities are appropriate the way it's in the neurotypical, and because those motor are not appropriate, it affects their cognition level. Now, this must be something new. Let's understand it in a very easier way. We all know child learns to, feed himself by sucking, right? Who teaches the child? No one. It's innate. It's a reflex. Child starts to, get up on the chest, then tries to sit, then tries to stand, then tries to walk. This is a sequence of development, right? In children in spectrum, you don't see that being deviated. What do you see deviation? Either they don't walk in time, later their imitation is not developed. These are the two criteria you have to be aware of. How much imitation level the child has developed according to the age. Is there any deviation? So if there is a deviation, you surely have a problem there. It's a first red flag. Child not developing imitation, and secondly, if the child doesn't have joint attention. Even if the child has eye contact but doesn't have joint attention, it's something as a red flag. So if these two in a prelim age, the child doesn't develop, then we have an issue. Why it doesn't develop? What actually happens in autism? In a very simple term, in a very simplest way, if you need to understand, the proper kind of stimulation does not happen in brain. So their receptors are not working as in neurotypicals. I think by now you all must have read about schema. So if schema goes wrong, they cannot adapt. Now, what is adaptation? Like you see some red color. So you'll say it's red, right? But not necessarily a child on spectrum will be doing so. To generalize their learning, to convert into understanding is something they struggle with. That is the difference between a neurotypical and an autism spectrum disorder individual. Now, saying here, you have to understand when we are talking about teaching technique, that's the main criteria we're going to talk today, how to develop and what we need to understand. So you have to understand what is this teaching technique I'm talking about. Okay. So first thing, even before we think or we want to plan something, you have to understand individual differences. As a parent, you have to understand that your child being on spectrum doesn't mean the same criteria of skills he'll develop like other individual. In fact, in neurotypical society also, all are not with the same skill. So individual differences you have to think about. Now, the first thing comes is aptitude. We all understand what aptitude is. So in this aptitude, you have to understand the child has the skill or not. So like everyone, the child may not have a particular aptitude towards what you are teaching. It may happen so. So if the child doesn't have an aptitude, then what will happen? You go on teaching and they don't learn anything. So it becomes very frustrating. Okay. Second is, people just miscorrelate this. That is intelligence and cognition. Both are not same. Intelligence is not cognition. Both are very different. Okay. Now, intelligence you're born with, the fluidic and crystallized, where you're born with certain innate intelligence. So with environmental influence and with exposure, to an extent, you definitely can, create more knowledge. But the basic intelligence is what the child is born with. Okay. And what is now cognition? This is interesting. This is where we have to think about. Cognition comes with whatever the stimulation you have, your brain conceives, receives, and understands. This is what cognition maturity is. Now, when we talk about autism spectrum disorder, we all know the associated problem or the issue is sensory processing. We all know that, right? So if sensory processing is an issue there, then of course their cognition maturity is not like what neurotypicals have. Their theory of mind is affected, central coherence is affected, and after all, the executive functioning. Now, executive functioning, the third level of cognition level, I say it's parenting problem too. I mean, parents become more overprotective. They want to help out the child. So in the end, what happens is child cannot use their logical respectivity like the neurotypical child. Okay. And abstraction of thought is not there. Logical inference is not there. So it becomes really a problem. So parenting should be more of helping the child use their own abilities, use their own logical capacity, not like giving more prompts. That way, you don't help the child. And of course, abilities can be different. Abilities can be really adaptable, but you have to work out A lot of structure can be done there, which really helps a child, help learn a lot of things. Now, before you start a teaching plan, before you start using the technique, you have to keep certain things in mind, which is the golden rule. Now, number one, when you're planning to teach your child, the first thing what we come across is inattention, or a child not giving proper kind of attention. So you have to plan on pairing and motivation. If you don't have a proper plan of motivation and you don't know how to pair there to bring about the attention of your child, your plan will not work out. The child will be showing too much behavior of escapism. So when we are planning, we have to make a proper lesson plan with a full motivation plan and a reinforcement plan, because motivation is not without a reinforcement. So you have to have a proper plan. Now, we know that children cannot adapt. Children on spectrum have issues of adaptation. So you have to use as much visuals and structure while teaching the child. Now, without visuals, without structure, children on spectrum or neurodiversity find it very difficult to have proper kind of learning. So think about them, plan it accordingly. A structure is 100% independent way of learning. In fact, we are also structure dependent. So you got to plan it over there. Next thing, you have to understand that our children have auditory processing problem. They cannot filter sound. If they cannot filter sound, you can understand that too much verbal prompt actually brings about a lot of behavior. So when you are trying to teach, you are teaching behaviors too. So it has to be that appropriate way of teaching where you're using too much, audio-visual learning and visuals will help a lot. So cut down on your tone of voice, cut down on your verbal prompts, use gestures, visual cues more. You will find 1,000 times better response in our children on spectrum. Okay. Excuse me. So before like I said, behaviors, they'll be having behaviors. Now these behaviors, how you curb them? You have to understand when you are making a plan, an intervention plan, there the technique you use, the errorless teaching, discrete trial training, these are the techniques you use that cut down behavior. So a child is more, they give a more appropriate response when you teach them if you cut them down. Okay. So what we do, we give, so the instructional strategies, let's talk about it right now. When we are going to teach our children, what will be the strategies to give instructions? Excuse me. Of course, the instruction strategies you need is visual aids and cues very appropriately. You have to use those visual aids in a very correct manner, in the sense, either use actual pictures or lines. Okay. Animation, a lot of people use animation, but I find that most of the children on spectrum don't understand animated flashcards. So better use real pictures, real cues. It will help them a lot. Again, instructional strategy should be very motivated, motivatedly planned, and reinforcers should be really probed and clearly stated what you are going to use. Again, when you are going to teach, please provide enough opportunities for choices. What we do is, most of the time, we don't give opportunity of choices to our children, where they cannot exercise their choices. This is something very important. And always never forget to encourage independent effort. If the child gives an independent effort, just do enough melodrama so that they love, and they feel so important that they have really done something very good. Because sometimes, or rather most of the times, we are too negative with our children if they do something wrong. So what we do is we try to always judge them. Don't get into the process of always judging your child. Sometimes the child may not perform. It's okay. Accept it. Don't think. Most of the parents think, oh, I have taught him and he has learned. Now he has forgotten. What will happen? Oh my God, the world will break on my head. Please. We all have ups and downs. Yeah, it is a problem when it comes to a spectrum child. But believe me, if your motivation plan is up there, the child will learn fast. He will not forget. Your technique matters. Now, when you sit down and plan, the most important thing to start with is task analysis, the teaching strategies. Now, what is this task analysis? Now, we all know that our children have splinter skill. That means in some skills, they are very good. And in some skills, maybe very easy skills, they just can't do. They find some kind of roadblock and they are stuck there. They just can't come out of it. So task analysis is making a complex work. It breaks down into the simplest step. And those steps, one by one, you teach your child. Won't they learn that way? Yes, they will learn that way. And actually, they learn it that way. An easier task is brought down to a very complex task is brought down to a very easier task. They find it very easy to catch on. So that is called task analysis. So first we do task analysis, and then we do functional assessment in understanding the skill we are trying to teach a child. He knows the prerequisites and concept or not. Because if he doesn't know the prerequisites and the concept for that particular task, then that task may not be appropriate for the child. And when you teach, you demonstrate and you model it first to teach the child. Like in the sense, this is something new you're going to teach to the child, and the child never has seen the work. It may be very difficult for the child to pick up. So it's best, even before you teach, you demonstrate and model it to the child. And when you demonstrate and model it to the child, then you ask the child to do it. Okay. And it should be a very consistent work. And it should be like, it should be with a goal setting. It should not be like out of the blue, you're doing it. It has to be with a goal setting. It has to be a proper plan there. Okay. Now, while teaching, you have to keep two things in mind. Like when I say consistent, that means it is with a goal setting. So there has to be a proper data. It has to be a proper way of doing systematically, and you are taking data. This data is very important. If you don't take data, you don't see a pattern. Their pattern of learning is very obvious when you start taking data. Like suppose very high functioning child. So how we set the data collection? We set the data collection like consecutive 3 yes. If he does it perfectly, then it's over. You go on to the next scale. Or child is little moderate there, then you take 5 years consecutively. But if there is a child who's too severe, he takes more time for that, then you don't get a consequent or consecutive yeses there. So what do? We take random selection there, and we take an average result. And if the average is on the higher side, then we over it and we move on to the next scale. Otherwise, child will get very frustrated, and small effort also will take it as a count. Okay. So it's very important. See, whenever you're going to work, one thing should always be in your back of mind: motivation. If it's not there, anybody will have a failed lesson plan then. Okay. So when we teach new skills, it's very important how you motivate, how you use reinforcer, and whatever you teach, reduction of behavioral excesses is something you have to work out on. And that's why ABA is so important. Now, when you teach, what are the planning? What are the things you need to teach? It has to be, very nicely planned. It should be broken up skills into language and communication, social interaction, play, cognitive, then your academics. ADL is so important, and you all can be achieved through structure. Structure is something very important. Please do go and learn, because it introduces why structure is important. Now, this is a question you should ask: why structure is so important? Because it introduces predictability. Where to sit and work, where to sit and have food. Because if you are hungry, you will not go to the bathroom. If you are, you have an urge for a toilet, you won't go to the dining or bedroom. You'll go to the bathroom. So that is the structured area we are brought up into. Understanding dining room, understanding drawing room, living room. So all those are the way of structuring. So it introduces, or, it helps the child understand predictability. They're highly anxious. It works there. Now, by doing structure, by doing the ABA or the skill development in a proper lesson planning, it develops their understanding of language, and they're able to respond. Attention increases, sitting habit increases, of course, desire to learn increases, imitation increases, motor coordination increases, all social understanding increases. So all those are very important. Okay. And if you use visual learning, they become concrete learners. Visual learning is something which really helps them a lot. I know sometimes a lot of people, they are not much aware of it, that visual learning can help. But then think about your own self. We are visual learners ourselves. Because see, some unknown place we have gone and you feel need of a coffee, or you are hungry. How do you understand where you can't read the script? You look for symbolism. So the symbolism makes you understand. So if you use symbolism in teaching techniques for spectrum children, you will be amazed at how much they can learn. So sight reading. In sight reading, we start with symbolism. We make them learn in a concrete way. So the concrete way comes with a visual structure also. Okay. So force, can you force a child? Force will not help you. Consistency, proper planning, working on pairing with your child, using visual techniques will help you. Now, for spectrum children, how you start teaching? What are the factors you have to keep in mind? So while teaching a child on spectrum, please understand what you are teaching. Does the child know? Suppose you are teaching something the child have never seen in life. Child has never heard in life. Is the child going to understand that? Where children developmental stage says Their learning starts from simple to complex. So, identification. Whenever you make a point of teaching anything, first make the child identify what you're going to teach. So, the learning should start from 3D perspective to 2D perspective. That means, suppose some object you're teaching to the child, use the picture of those objects. It's much more easier to generalize. So until and unless the child learns and doesn't learn to generalize, then the learning doesn't happen. Learning happens when the child learns to generalize. Okay. So identification, and from there, from 3D to 2D, from 2D to worksheets. Another set of work line, imitation level. Now, this imitation level is must. Why? Why a program for teaching needs imitation to be there? Because that's one of the cognitive skill we all human need to understand our surrounding, our environment, our perspective of others. So imitation is a right kind of a thing you need. And also it creates attention, joint attention, of course. So first you start with gross motor, then you move on to fine motor, head movement, lips and tongue movement, and then you go into sound, not before that. So this pattern of teaching will help the child to verbalize also. Okay. Secondly, using picture communication, using picture cues, gives the right kind of understanding of what the child needs to do. Okay. Like suppose you want to teach the levels of mathematics. So if you want to teach him values are something you cannot see. So how you teach value? So you use concrete things, concrete objects to make a structured way of teaching value. So these are the perspectives you have to understand while teaching a child. And the most important thing, which we all try to miss out on, is first jot down what the child likes or dislikes. Now I'm coming to the most crucial thing, the communication part. Likes and dislikes are very important thing you have to note down. Because you see the child who cannot communicate, if we use something of their interest, something they like, we use those as the communicative tool. Like suppose, what should I give an example? Okay, the most popular thing among children is a car. The child loves a car, right? Child plays with a car. How I enter his world, how I connect with the child. Of course, I'll take a car and I'll start playing zoom, 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 zoom. So the child will see, okay, this lady, this fat old lady is doing what I'm doing. Okay, I can make a connection, right? So he will look at me, he'll give a smile, and then I have made a pair. So now I am paired with him, I can make him do anything. So I start with him, teaching him this object, that this object is a car. So in manding, how to ask for, the child starts grabbing. I'm going to block and teach him how to ask for it. I can use picture exchange. I can give, gestural behaviors, how to ask for it. And slowly, gradually, I go into language also. So first thing I have to make sure, when I see car, he knows what car is. So that when I ask him, I teach him to ask, he should know that he's asking for the car. So while teaching communication, this is something very important. Some children engage into some odd things. It's okay. If they line up, you also line up. Now, this lining up is literally misunderstood by the most of the community, the why they line up. If you read and try to understand the cognition inference, the logical part, how it develops in human, you'll find there's a roadblock in autism spectrum. So they line up because it's somewhere to do with that logical inference not being developing. So they find it very soothing and they stim like that. So what I can do, I can give him a lot of things in sequence and they love to do so. So I make it a play and teach him and he learns. So you convert his interest area into learning. Okay. So consistently you teach him with motivated plan. Children on spectrum do learn a lot. Now, they may not learn things the way we teach, but they do learn if we break down a subject and understand their understanding and accordingly make a plan and teach them, they definitely learn. So 2-3 things again I'm going to add over here. Now you have a perfect plan. You have made a lesson plan according to the child, assessing the child, and you have listed down on cognition maturity you're working, on motor ability you're working. What are the helping tools you need other than visual cues? Initially, you need a shadow. Initially, you need someone to give a prompt. Basically, a single person can also work with a child, but some children are too hyper or they wouldn't sit for a longer period of time. So initially, you introduce a person who will prompt him from behind. What instruction you are giving, the child may not know. So either you become a shadow or you take a shadow behind the child. So the shadow will be working on behalf of the child or talking on behalf of the child. So that sometimes, like, you ask a question and the child needs to answer. So the shadow may prompt the answer very in a low tone in the ear so that child understands to speak what they have to speak. Okay, like most of the time somebody asks, what is your name? The child keeps mum because most they don't understand, they need to answer that. Why should they be answering somebody unknown? So a shadow may help from behind, just uttering that his name in the child's ear in a very low tone. So that's shadowing. Or in a classroom situation, the teacher asks the child to take this book out, to take this out, or do this on your book, or imitate from the blackboard. The child is clueless of what they're supposed to do because hardly they get school training. Little bit of school training helps them, but they hardly get it. So a shadow can do that as a help to guide the child, saying utterly nothing, just prompting that this is what your teacher wants you to do. So child can relate with the instruction given and the child understand, okay, this is what I need to do. The shadow is not supposed to speak. So if the shadow doesn't speak, she doesn't interfere in the instruction given by the teacher. So it helps the child. Okay. Now, while talking about this shadow, again, it needs to be fade away. Shadow cannot continue for ages. At the most, according to the child's ability, 6 months to 1 year, or at the most 2 years. Then slowly, gradually, shadow needs to be fade away. Because whatever we are teaching, we are going to teach the child to be independent, not dependent. Okay. Another thing in learning strategy, use as much structure, Use as much visual cue, like before also I have said, it's very concrete level of learning a child can have. Again, the last part, coming to the last segment, what is something very important in learning strategy is reinforcement. A lot of people understand that reinforcement is like bribing. Is it? No. Reinforcement is not bribing. You don't say, do this work, I'm going to give you this. That's bribing. Reinforcement is your reward system. Now, this reward system, we all want reward in our life, don't we? We all want appreciation. If we do something for others, we just want in return maybe a thank you also. That makes us happy. Same goes for our children. Now, basically, why reinforcement is a principally accepted thing? Because we know they have inattention problem. We're not going to force learning. And frankly, child as much understands the mother, they don't understand others quite readily. Okay. So why should a child listen to me? If I'm not interesting, if I'm not so much accommodating, why should the child listen to me? So principally, I am building a relationship of trust and faith by using the reinforcement and the reward system. If he makes an effort, if he tries to do something, even a little effort will be recognized by me by giving a tangible reinforcement. And I'm adding, oh, you did the good job. Good boy. Now slowly, that tangible will fade away. Who's the real reinforcer over here? It's me. I am the one who's reinforcing. I'm just using some tools for initial moment. And slowly, gradually, those are going away, fading away. Who remains as a motivated therapist? Me. So I am using reinforcement motivation plan to make the child connect with me. I cannot force, but I can love. I can give, spread out that kind of atmosphere to the child. See, you can trust me. Sometimes children are sick. Don't force learning. It's okay. If you're not following the total program you have made for the child, it's okay. Sometimes teach him less, sometimes teach him more, but never cross the line. That way, we cannot understand, to make them, not like the subject. Most of the therapists say the child is not interested. I'm telling you one thing, the therapist being bored can never be interesting for a child. Child needs everything in an interest way. And you create that interest, of course they learn. So if the child is not able to learn, then the therapist is not working properly. She's boring. Okay. Don't be a bore to a child. Then it doesn't work out. You have to play with the child. You have to be a child with a child. Then your work becomes easier. So, few things you have to keep in mind. First, never start work at the go work. The first thing, pair with your child. That's the golden principle. First, you pair with the child, enter the child's world, create a faith, make a proper lesson plan. It should be motivated one. And the foremost thing, you should have a proper control on the table. You should not go about how the child wants. It should be the control in your hand, but in a playful manner. Because children on spectrum will always tend to have their own way. Because they don't know our way. They are not supposed to know our way. So very subtly, we have to teach our way to the child. Okay. So that's something, little hard work, maybe, but it's very redeeming, because you don't struggle, because you don't become that agony auntie. Okay. So it's all about something good and something very motivating. So I hope I have made you understand the techniques. So we can come to a conclusion now. And if you have any questions, you can ask them. They can redirect the questions to me. And what more you want to know about teaching technique, you just let me know. Okay. Thank you. So can we end it over here? And it's very nice to be on the platform.